Uh, Good afternoon, everyone. Thank you for being here. For those of you that don't know me, my name is Jennifer Wright. The clinical director and the owner of Kaizen Wellness Centre. Kaizen has two locations, one in Kelowna, where we offer neurofeedback and neuromodulation services exclusively, and one in Revelstoke, where we offer neurofeedback and neuromodulation services alongside a lot of other counseling modalities. We also, in partnership with our sister company in Revelstoke, Revelation Psychedelic Therapy, offers ketamine-assisted psychotherapy. Today, we're focusing on a basic overview of neurofeedback, especially infra-low frequency, often called ILF neurofeedback. By the end, you'll have a clear understanding of the common myths surrounding neurofeedback versus the actual evidence, what neurofeedback is and how it works, how ILF differs from other types of neurofeedback. We're going to do pretty just basic overview of that. Some symptoms and conditions that ILF helps the most. We'll go over some real-world case examples from our clinic. At the end, I'll address some frequently asked questions. And if you need to leave early, I assume some of you might be on a lunch break. If you need to leave before the end, or I'm still talking when you need to leave, but you have questions, you can leave them in the chat and I will answer them before we end the recording. And when we send you a link of the recording, you can just go back at a later time and see how I answered the question. I want to start today with the myths around neurofeedback because there are quite a lot, and sometimes it's good to just answer or to address the elephant in the room, as they say. The first myth I want to address today is that neurofeedback is not evidence-based and that it's not in medical research. So neurofeedback is an evidence-based intervention with decades of published research, including randomized and sham-controlled trials. The evidence is stronger for some conditions than others, but the field is firmly rooted in neuroscience and ongoing clinical investigation. So if you ever hear that neurofeedback is pseudoscience, that simply isn't supported by the evidence. I have a list of universities and teaching hospitals here that are researching and using neurofeedback. This is just a small sample of the many universities and teaching hospitals that are using neurofeedback. I've listed really just the most widely recognized institutions. The full list is much longer. I think what we can see here, but originally I had what each one of these institutions was doing with neurofeedback, but that ended up being way too long. So what we can see here is that neurofeedback is studied in top neuroscience labs and hospitals worldwide. So it has a global research footprint. We can see that there's a range of conditions that are studied. It's been researched for ADHD, anxiety, depression, PTSD, epilepsy, concussions, chronic pain, and sleep disorders, just to name a small list. Some areas of well-established evidence base and other areas are still emerging in research. It's also important to recognize that neurofeedback is not a single method. There are multiple approaches used clinically and in research, which can make the field seem a little bit confusing if you're looking for a simple one-size-fits-all explanation, and it can make navigating research even harder. We do have a large section of research on our website. We also have a compare and contrast different modalities on our website. So if you want a deeper dive or more in-depth look at things, you can go to our website. It's a good place to start. I think later in the winter, we'll probably give more advanced coverage to some of these topics for people who are interested in that. So a helpful way to think about this is that neurofeedback is like an exercise. Just like running, swimming, yoga, and weightlifting all work differently, yet they support overall health. Different forms of neurofeedback are going to target different neural systems and have different therapeutic goals, but they all aim to improve regulation and functioning. Within these institutions, we can also see that neurofeedback is being combined or used alongside other advanced technologies such as fMRI, FNIRS, and wireless neurofeedback systems that are being used in integrated neuromodulation treatments. It also has a multidisciplinary clinical use. It is used in psychiatry, neurology, pediatrics, psychology, occupational therapy, rehab teams, and often being used in coordination or collaboration with multiple providers, which is really lovely and exciting to see. So I think what all of this establishes is that neurofeedback is not fringe. It is an established, evolving part of evidence-based care. Some of the other common myths here that I've heard it's mind control, like MK Ultra, which is not true. There's no subliminal messaging. Nothing goes into your brain. It's 100% non-invasive. I've heard people tell me it's dangerous, which is always interesting. It's not dangerous. It has an excellent safety profile. I don't even know what I don't even know what else to say about that. I guess side effects are really rare, and if they do occur, they're pretty mild and transient. Okay, it can change your personality. Nope, it's not going to change your personality. It will improve regulation, but it's not going to overwrite who you are. It's a placebo is probably one of the most common myths that I hear. I think, as unfortunately, I don't know why the field really can't get away from this myth, but there are a lot of controlled studies that show objective changes that last for sustained period of time. When researchers check back in with people who have been through neurofeedback, months and years later, they're still reporting those gains. That far exceeds any placebo effect. You also don't have to go much further than the origin story of neurofeedback. In 1967, it was originally discovered in a neuroscience lab where they were studying cats. So you can get placebo effect with animals. Pretty hard. I think most of us can understand the personality of a cat may not be the easiest animal to have a placebo effect with, specifically a large group of them. And even still, the research was well controlled for placebo effects. So even in its origin story, and all along it's been demonstrating it's not a placebo effect. The other one I hear a lot is that the results don't last. Because it's learning and not a temporary chemical effect, like using a medication, they do last. It does work better when it's integrated with good clinical care, like counseling, medical support, or lifestyle changes. The research does show that 70 to 80% of people report sustained benefits for years, months later. I think one thing that's important to understand, though, is that your life doesn't happen in a vacuum. So if you do neurofeedback and then you get back to your life as usual, and then you have a head injury, or you experience something traumatic, or you go through a major hormonal renovation like perimenopause or puberty, or maybe you go out and have a lot of fun at Burning Man and you use too many drugs for an extended period of time. All of these things are going to impact the overall strength and stability of your brain. And so any strengthening you do with the foundation of your brain with neurofeedback can be impacted by external variables. Having said that, it's really common for us to hear from people if they do return for tune-up sessions that they'll say, yes, this injury happened, or yes, this traumatic event happened, but maybe they say, but I didn't relapse. Or, yep, I had to go back on a medication, but I didn't have to go back on high as a dose as I was before neurofeedback. Or maybe I went through this incredibly traumatic event, but my emotional stability and my regulation was a lot better than it was historically prior to doing neurofeedback. So even when variables happen in our life that challenge the brain stability and the strength that we've built with neurofeedback, we do see that neurofeedback is still showing its effect. And oftentimes these people will just come in and, like I said, for like a tune-up or a booster session. Where am I? Oh, it replaces therapy. No, it does not. It helps therapy work better. I'm going to give a case example of this later. And okay, last, if I don't feel something during the session, it's not working. Some people feel neurofeedback in the session. Some people don't feel anything during the session. We don't really know why. There's some working theories around this, but nothing's been proven. I think the important thing to keep in mind here is that if we keep a scientific mind, we want to track symptoms over time. It's far more reliable to do that than judging the effects in a single session, right? So even for people who feel really good during neurofeedback training and they're noticing the training, you don't, that's not the way we gauge whether or not a treatment is working. We do that over time as we continue to monitor the symptoms or the conditions that you're coming in to treat. Okay, I think we can move on now to, for those of you on the audience that don't have any background in neuroscience, or you're just not a healthcare, maybe you're just here to see if neurofeedback would help you or somebody that you know, but you're not a healthcare provider. I think it's important for us to start with an understanding of how your brain communicates. Your brain communicates two ways. It communicates electrically and it communicates chemically. The metaphor that I use is that the electrical communication of the brain is like a road. The chemical system of the brain, the transmitters, excuse me, are like the cars on the road. And so you can have really good cars, but if your road is full of potholes or there's sudden drops or traffic jams, or maybe it's not even a paved road, things are going to get backed up. So neurofeedback helps repair and strengthen the road so that everything else is working better. Stated differently, neurofeedback helps strengthen and repair the electrical network functioning of your brain. So now that we know that it is working on the electrical functioning of the brain, what do you need to know about that? Not a lot. For today's presentation, we're just going to use a metaphor. I want you to imagine that your brain is like an orchestra, where different instruments are playing their own parts at the same time. Each brainwave frequency, delta, theta, alpha, beta, and gamma, is like a different instrument that's contributing its unique sound to the overall symphony. Some instruments are playing softly, like delta during sleep. Others are playing more loudly, like beta during focused thinking. But they're all playing together to create a complete, balanced performance. I'm going to use this metaphor a few times, so we'll come back to this. But let's go now to what is neurofeedback. It's brain training. That's the simplest definition of it. We are measuring your brain's electrical activity, and then we're reflecting it back to the brain through visual feedback, tactile feedback, and auditory feedback. Your brain is using that information like it's looking into a mirror. So a really good metaphor here to explain this is that it's like going to a physiotherapist's office and you're trying to rehab a shoulder injury. So you're in there and you're doing your exercises, but you're looking in the mirror because you want to see, where am I tensing? Where am I guarding? Where am I compensating? And in time, as you are being able to observe what you're doing, you move better because you can see what you're doing. You get smoother movements. So neurofeedback is like a mirror for your brain. And your brain begins to function better because it can see what it's doing. So let's talk about what a session looks like. An ILF, or infralow frequency session, is pretty simple and it's very comfortable. You're going to cut each session lasts for about 30 to 50 minutes. Each session is going to entail you coming in. You're going to sit in a nice lazy boy chair that reclines. On the wall in front of you is a large screen TV. We're going to put sensors on your scalp. You can see them here. There's always three, sometimes there's four. They're very light, nothing pulls, nothing stings, nothing pinches, nothing's painful. These sensors are microphones. They're not putting anything into your brain. They are just listening. And we do move them around throughout the session, depending on which networks we're trying to train in the brain. So we use something called a 10-20 system. That's just kind of like a map where you can find different networks or regions of the brain. So we're going to turn the TV on and we're going to turn our system on. And you're going to watch TV. And your technician behind you is able to see the electrical activity of your brain. And he's making subtle adjustments, maybe, while the system is reading your brain activity. As your brain shifts towards, let's say, less regulated rhythms, you're going to notice in the feedback, the picture on the TV screen is going to get smaller. It might tremor a little, or it might be less clear or bright or vivid. The teddy bear, so there's tactile feedback is a teddy bear that people hold on to in their lap. The teddy bear will stop vibrating. And the auditory feedback, sometimes in certain types of neurofeedback, you have headphones on. And if you're using an auditory feedback component, you'll notice that the sound gets clear, maybe, or not clear, it's less clear, lower, and kind of staticky. As your brain moves towards more regulated rhythms, you get rewarded with better feedback. So the screen becomes clear, bright, and large. The bear will vibrate. And if you're using headphones, the sound will become more clear and at a reasonable octave so you can hear it. You don't have to to do anything. Your brain is going to adjust itself automatically. And I think that's the really nice thing about ILF is that you really can come in and just watch a television show, play a video game, or watch a movie. Because your brain's a self-organizing system and it prefers stability, it's naturally going to start repeating the rhythms that gets smoother feedback. This is usually the time in my explanation where I can see people kind of struggling, and I usually get, like the question, yeah, but I still don't get how watching TV is doing all of this. There is a deeper, more complex answer to this that involves learning about the predictive speed processing of the brain across different frequency networks and states. But for today, I think the most important thing to understand is that it's learning through tiny rewards. Your brain is making thousands of predictions each second, and then it's testing those predictions against reality. When it makes a prediction and it doesn't match reality, that's called a prediction error. And your brain will try again. And it's doing this thousands of times each second. And it's doing this without conscious awareness, like I said before. So there are some metaphors that sometimes we use to help explain neurofeedback and kind of how it's working is that it's like weightlifting for your brain. Each time you come in, you're strengthening regulation muscles. Another type of metaphor is that neurofeedback is like riding a bike. When you're first learning how to ride a bike, it's hard. There's a lot going on. There's your feet and pedals and your hands and your body, and you're trying to stay balanced and go straight. And, it's not going smoothly in the beginning, but as you get going and you learn, the brain, everything becomes smoother, right? And then you're successfully riding a bike. And this is a really good metaphor that describes why neurofeedback lasts, why the results of it last. Because like riding a bike, once you know how to do it, the brain doesn't forget. Well, outside of extraordinary circumstances like I don't know, a head injury that would cause amnesia or something. But the point is you can go for a year or 5 years not riding a bike. And when you go to ride a bike again, your brain remembers how. I mentioned before that there's several types of neurofeedback. They all help with self-regulation, but in different ways. I don't have time tonight to go into each type of neurofeedback. So because we're focusing on ILF, and ILF is different than all of the different other types of neurofeedback, I'll just describe an umbrella term of traditional neurofeedback and how that compares to ILF. When I say traditional neurofeedback, it doesn't mean that it has been around longer than ILF. Some of them have and some of them haven't. It's just what distinguishes ILF is that it's the only type of neurofeedback that specifically targets the brain's infraslow frequency range. So these are ultra slow brain waves that are below 0.1 hertz. Other neurofeedback forms focus on faster frequency bands like alpha, beta, and theta. So the key difference here is the frequency range that's being targeted, not the length of time that each has been practiced. So I'm going to give you two metaphors. The first metaphor to understand different frequency ranges is a tree. At the top of a tree are the branches, and we're going to say that that part of the tree represents fast frequency brain waves that all types of neurofeedback except for ILF focus on. That's your gamma, your beta, your alpha, your theta. These are fast frequency brain waves up here. Down way in the roots where nobody's looking, and for a long time nobody paid attention because they didn't think they did anything, are the ultra slow oscillating rhythms. Similar to the way neurology forgot what glial cells are, for a long time, scientists just didn't pay attention to these slow oscillations. They didn't think they did anything. But similar to the way we know how critical the roots to a tree are, we also now know these frequency realms are actually incredibly important to the overall health, stability, and functioning of the tree and to your nervous system. So moving on to our second metaphor here, go back to your symphony. Traditional neurofeedback is like adjusting just the violin section. Maybe the violin section's playing too loudly and I want to downtrain it. Maybe another section of the orchestra is playing too soft and I want to uptrain that frequency band. This is how all other neurofeedback types work. ILF is the only one that's different because it's working directly with the conductor. The conductor is the ultra slow rhythms, like I said before, below 0.1 hertz, that keeps the whole system coordinated. These frequencies regulate arousal, emotional stability, sensory integration, sleep, and autonomic balance. So this is why ILF is especially effective for things like challenges that reflect a system-wide dysregulation instead of a single function. For more clinical oriented people, the frequencies in ILF are shaped by neuroglial networks. So remember when I said the forgotten child of neurology for a while were glial cells? We're in the same neighborhood. These systems, they're involved in stability, inflammation, metabolic regulation, and foundational arousal patterns. So we're not training glial cells directly, but ILF does operate in the same frequency domain that glial neural communication influences. So it's one reason why ILF supports improvements in your sleep architecture and your sensory processing and autonomic balance and emotional stability. In other words, it supports conditions under which the entire brain functions well. We see that ILF is gentle and adaptive. It produces, instead of producing more of this and less of that, it's not pushing the brain. It tends to be very calming and settling and integrating, and clients often describe the experience as though their nervous system is exhaling. They often notice early improvements in sleep, stress tolerance, and emotional reactivity. It also tends to produce fewer transient side effects. Other types of neurofeedback can often create irritability or headaches or fatigue, especially early on in training. That kind of results from pushing specific frequency bands in different directions. Specifically with a complex or a very sensitive nervous system, you tend to see side effects with other types of neurofeedback. So in general, the clients feel calmer, they're more grounded, and they're more settled. It's more adaptive. So um, instead of up training and down training, it's providing continuous moment to moment feedback signals. It's like the subtle mirror that the nervous system is using to regulate itself. If you have a sensitive or complex nervous system, this really matters because, like I said, if you're pushing frequency bands up and down and you have a complex or sensitive nervous system, you're going to get side effects. It's also highly individualized. Other types of neurofeedback use Z-scored or QEEG guided neurofeedback. A QEEG is also known as a brain map. What's the difference between that? It stands for quantitative EEG. I'm not sure if I mentioned that. So what's the difference between that and a normal EEG that we all know about? And an EEG is a recording. A QEEG is the analysis of that recording. So what these other type of neurofeedbacks do is they start with a brain map and they take the data and the recording from your brain, they compare it against a normative database, a database of quote unquote normal brains. And then they train your brain towards the statistical norm that's in that database. If you're, excuse me, if you're a peak performance athlete, or you're a really creative professional, or you have a sensitive or complex nervous system, you are not looking to be average. And so we see that neurofeedback, ILF neurofeedback really shines here because it's providing real-time continuous feedback that's based off of the brain's strengths and needs on a moment-to-moment basis. It's not training your brain towards someone else's template. The clients have better experiences, and so they get better outcomes, especially kids and adolescents, because we use movies, TV shows, and video games. So we're the only type of neurofeedback where a child can come in and watch a movie or watch their favorite TV show, which can be really important. Think about a small child on the spectrum. Sometimes movies or TV shows we see are part of their regulation. It's part of how they regulate in stressful situations. Sometimes it's part of how they communicate with people. And so it's really beautiful for those kids to be able to come in and use something that they're familiar with and receive a treatment at the same time. And if you're an adolescent, specifically an adolescent who's refusing therapy, coming in and being able to play video games or watch a movie is pretty fun. There's really no stigma to it like there is in therapy. So we usually see the adolescents who are refusing to go to therapy come in, and they usually want to take pictures of themselves and bring friends in. And they're really excited to do it. They're engaged in the and participating in it. And the parents like it because the kids become more regulated and their behavior improves. Oh, geez, where am I? I think I made it all there. We use ILF as the foundation in our clinic because it stabilizes the whole regulatory system, and it's going to prepare the brain for everything else: therapy, learning, executive functioning, emotional processing, and even traditional neurofeedback if I want to switch over to that, or neuromodulation. So because it supports the fundamental levels of regulation, because it's well tolerated even by complex and sensitive nervous systems, and because it creates conditions for other modalities to work more effectively, this is the method that I choose to exclusively work with in my practice. Once the system's stable, I might incorporate more targeted protocols. So whether that's therapy, somatic work, or neuromodulation therapy. Why would I use neuromodulation therapy over traditional neurofeedback? I'll give you kind of a short answer to that. We're not covering neuromodulation in this presentation. We do have a presentation on our website that goes very in depth into that science. It's by Dr. Dogres, who created that technology. I should tell you a little bit about Dr. Dogres. His career started in neurofeedback. He actually trained with the mother of neurofeedback. Her name was Margaret Ayres. So he spent decades with neurofeedback and then eventually moved into something called lens neurofeedback. You will hear that term. Lens neurofeedback kind of sits on the border between neurostimulation and neurofeedback. There's some controversy, or there has been in the past, over whether or not it's really neurofeedback, because it does participate like neurofeedback, but it's also administering like a magnetic impulse into the brain at the same time. So it is also giving a form of stimulation, to the brain. So this was a natural step for him into what he ended up creating on his own, which is technology that uses alternating and direct electrical current, photobiomodulation, which is red LED lights, and pulsed electromagnetic field. And he uses it all together. Why do I use that when I'm done with ILF instead of traditional neurofeedback? Because in my clinical experience, it works faster and it's stronger. If I'm going to switch over to a modality that's less tolerated, I'm going to switch over to the one that I can achieve the fastest results with and the best results with. So let's move to the conditions that neurofeedback can help treat. In general, ILF neurofeedback is really helpful when the nervous system feels unstable. So when it's stuck on and hyperarousal, or it's stuck off and hypoarousal, or if it's swinging wildly between the two, ILF is a really good solution. We already talked about peak performance, so we can move here in our clinic. So yeah, this list here. In our clinic, we've seen neurofeedback work really well for all of these conditions or symptoms. So I'm not going to go through all of them. I'll just highlight a few of them. Panic attacks and panic disorder is, I don't know, other than medication, I don't know of another treatment that works as powerfully, as fast, and as well as neurofeedback, specifically ILF neurofeedback for panic attacks. Mood swings, again, you see an unstable nervous system swinging between states. So mood swings are one of the earliest things that we see normalize in people who come in for ILF. Depression. Depression is, yeah, we've seen, and I'll show you in a case today where depression resolved. If it's treatment resistant depression, I don't find that neurofeedback is a good standalone treatment. It's usually better when it's used alongside of therapy and/or therapy and medication. Let's see, ADHD, impulsivity, and irritability, especially in children. You'll see most of the research on other types of neurofeedback is evidence-based for ADHD. For ILF, what I find it helps first and pretty early is it normalizes sleep. Those really big emotions that lead to emotional reactivity calm right down. Impulsivity improves, negative thinking improves, irritability improves. So oftentimes that busy nonstop like mental anxiety will improve. But other symptoms like time blindness, forgetting my keys, sometimes the fluctuation of like that hyper focus and inability for sustained focus, that I find that once we settle the core nervous system with ILF, I usually transfer over into neuromodulation to get the rest. And it works beautifully. That treatment protocol, that regime works really well, especially if you have someone with ADHD with a trauma background and can't maybe handle other types of neurofeedback. Autism, yes, I don't know how to say this, stress this more importantly. We're the only clinic, I believe, in the interior of BC that will do neurofeedback for children on the spectrum. It's not because other neurofeedback clinics are discriminating against ASD or children on the spectrum. They're not. It's that it's very hard to get a QEEG on a child with autism. It's also hard to get them to stay there when they're not engaged. And so, because we can do the TV with the movie and the shows, and because there are only a few mild light sensors, and because we don't require a QEEG, we see that it's just an easier entry point. They can stay in treatment longer. It's also just better for that nervous system that really experiences a lot of sensory overwhelm or sensory processing issues. Post-concussion symptoms. If you've had a concussion and you've gone through all of the conventional medical treatment and you still have symptoms, or you've had repetitive concussions that over an extended period of time have led to a worsening of symptoms, this is one of my favorite presentations to treat because it's so good. ILF is so good with it. It's an unstable nervous system, right? And because of the injuries. And so again, this is another one where I really don't see any other treatments that I know of work better than neurofeedback. You do need to do the standard conventional medical treatments first. Anybody that gets a brain injury, I don't want you coming in the same week or even the week after. Your brain does need time to heal before we start, doing weightlifting with it, but it's very powerful. Functional neurological disorder. This used to be called conversion disorder. I could give a full presentation on this. This condition falls between neurology and psychiatry. Patients often get lost in this one with pretty life disabling and horrible symptoms. Neurofeedback is good for functional. It has one of the only things that we know about FND is that there are key signatures that we can see in specific neural network regions that you can see over and over again in FND. So yes, training these neural networks is helpful for FND. It should never be a standalone treatment. We have had jaw-dropping experiences using neurofeedback and ketamine-assisted psychotherapy. To my knowledge, our last case with FND, that's hopefully we're going to publish that soon. Right now, we're working with a psychiatrist at Harvard for that one. To my knowledge, there's no documented research anywhere that shows the type of results that we got with that. So for a disorder that doesn't have a lot of treatment that's really great and not a lot of treatment success, neurofeedback and especially neurofeedback with other types of therapy is really good. Okay, dissociation. A couple years ago, I had the pleasure of being at a ketamine training with Bessel van der Kolk, who, those of you who don't know who he is, he's the world's leading expert, one of the world's leading experts on trauma. He wrote The Body Keeps the Score. And we were having a discussion about ketamine. Well, really, we were having a discussion around psychedelic therapy versus neurofeedback. And to quote him, I don't know of another treatment anywhere that actually works for dissociation besides neurofeedback. So dissociation, yeah, is something we do see a lot of success with. Seizures and epilepsy is where the science began, and that's the very first condition it was researched for. So we do see success there. Dizziness and vertigo, nausea, motion sickness, night sweats, hot flashes. You can see these are acute episodic events that are really uncomfortable. So you see an unstable nervous system that's swinging, right? So all of these symptoms, when I see a cluster of symptoms like that, I'm automatically referring into neurofeedback because I don't know of a medication that will work on all of these symptoms in one go. And I don't know of another treatment that will help all of these symptoms in one go. There are treatments out there that will help all of these individually. But when you're talking about people's time and their money, I think neurofeedback is really helpful. Anyone with a sensitive nervous system who reacts poorly to medication, but more specifically, anyone who has paradoxical reactions to certain medications, we usually see those people do really well. So anyone's brain who can't stay steady is a good referral to ILF neurofeedback. So I've talked a lot about what it can do. Let's talk about what it can't do. It cannot reverse a neurodegenerative disease. If someone with a dementia profile is coming in for neurofeedback, it's for emotional calming only. We cannot slow anything down and we cannot reverse anything. It is not going to repair major structural injury. It is good at helping rewiring network functioning around injury, but it will not bring back severely damaged or dead brain tissue. So we'll talk later about a case that we did with a gentleman who had a series of strokes. And yeah, he had a really big improvement in a lot of his symptoms, but you're not going to return back to baseline functioning. Anyone who has an emergency, a medical emergency or a psychological emergency. So if someone is really suicidal, neurofeedback is not where you want to send them. They need a medical team. If someone's actively experiencing psychosis, again, neurofeedback is not what they need. They need a medical team. It does require attendance. So people who have a hard time attending their appointments, neurofeedback's not good for them because if you don't come, you don't get better. It's like going to the gym that way. Anyone who's asymptomatic, so those unicorns out there who have very flexible, strong, calm nervous systems, and they're doing just great in life, who I just am in awe of. There's not a lot of them, but they do exist. Those people really don't need neurofeedback. It's not for them. It's not going to hurt them. They can come in and do alpha theta, which is one of my favorite types of neurofeedback, which is it's like a spa, meditative spa treatment. But yeah, typically you can see that neurofeedback is going to help the brain do what it's still capable of doing, but struggling to organize. It's less effective or powerful when the tissue itself is severely damaged or degenerating. So when somebody comes in and they have a huge 3-page list of symptoms and they say, I've seen every specialist, I've done every test, I've done all the medications, I've done all the treatments, and none of it helped. And furthermore, no one knows what's going on. Those are usually a good referral to ILF neurofeedback. If I'm worried in the intake that it's not something neurofeedback can help with, like let's say there's a Chiari malformation, neurofeedback will help with, but the symptoms, they're going to come back. There's no sustained benefit there, or there's very little sustained benefit. Or if I think it's environmental, maybe it's genetic, maybe there's something like lead poisoning or something else going on. But we do really careful intake screenings to be able to rule those things out. And so most of the time, the cases that come in that just look really gnarly, they're the ones that we see make huge treatment gains. So let's talk about some case studies. Ooh, I'm running out of time. Oh gosh, sorry. This is a testimony from a mom from one of our little girls with autism. I'm not going to read it because it makes me cry every time. She's done beautifully. She's probably one of our most profound cases with autism, in that just the progress she's made has been astounding. Okay, we had a female age 16. Mom called us repetitively for weeks every day and just a lot of distress. She was terrified she was going to wake up and find her daughter dead. Her daughter was suicidal. She was self-harming. She had compulsive behaviors. She was severely depressed. She had severe anxiety. Additionally, she was refusing to go to therapy, which was just really, as you can imagine, gut-wrenching for her parents. She did agree, however, to come into neurofeedback. So this is a snapshot of her overall training. You can see where the graph is really high. is where her symptoms began, and this nice trend downwards, where you can see by the end of 33 sessions, she had huge symptom improvement. We can take a closer look at that here. I won't go into all of the symptoms. We just pulled a few out here so you can see that her panic attacks, paying attention, remember I said panic attacks, went from an 8 to a 0. She had 100% improvement in panic attacks. Depression went from an 8 to a 0, so 100% improvement in depression. Her ability to think clearly improved by 67%. Her anxiety went down 45%. Paranoia was not clinically, it's not clinically true paranoia, but she experienced feelings of paranoia that were really, and she knew that she was paranoid, so it wasn't true paranoia, but it was really uncomfortable for her. And she'd been 88% improvement in paranoia. At the end, she was like, yeah, I'm like every other adolescent who thinks that everyone else is talking about me. So she felt like it was pretty normal. The other thing that was really beautiful about her was that when she was done, I think she did 30 sessions in a row. And then when she was done, some stressful weeks would come up, like exam weeks or whatnot. And she would call us on our own and say, hey, can I come in and just do an extra session? This week's going to be pretty big for me. And I just like the support, which was really cool, especially when this was a child in the beginning who was refusing any kind of therapeutic support. This 31-year-old female with a chemical TBI. I've known this woman for years. She was a client of mine well before this injury happened. She had so many symptoms when she came in with this brain injury that we had to pull 3 symptom trackers because we couldn't fit it all on one. And she came in for her very first neurofeedback session. The room was totally dark. We had a stationary screensaver type thing on that was really dark. And she sat kind of off to the side, covering one eye and just looking out of one eye. By the end of her 86 sessions, she was laughing with Brooklyn Nine-Nine. You can see, we'll go through quickly here. She made amazing success. This is a woman who lost her driver's license. She lost her license to work. It was devastating. Her poor fine motor controls, so she couldn't do things like pick up a knife and cut a piece of garlic. That improved 90%. Vertigo improved 100%. Difficulty thinking clearly, 89%. Difficulty understanding conversations, which is incredibly isolating, socially isolating at a time when you need tribe. That improved 90%. I think we have some more here. Yeah, we do. Poor verbal expression. This is not a woman prior to the injury who struggled to verbally articulate herself, but this was a significant symptom when she came in with the injury. It made a 90% improvement. Body awareness, her poor body awareness improved 90%. Lack of alertness improved 90%. What else have we got here? Lack of social interest, right? Head injuries are an invisible injury. And when they go on over an extended period of time, people lose their support networks and they're incredibly isolated. It's very lonely and it's devastating. So her lack of social interest was 100% resolved. Her poor gross motor coordination, 86% involved. She couldn't even, if she was walking on a sidewalk and wanted to step down into the street, she'd have to stand there for a couple of minutes to figure out how just to take a step down. Muscle twitches, 90%. Yeah, you can see lots and lots of improvement here. Her overall symptom improvement was 74% by the time she was done. She was able to apply and get her driver's license. She was able to get her license back to work, return to full social functioning, to travel. It was really, really beautiful to watch. Okay, who do we have next? We have a 53-year-old male who had a stroke. He did 60 sessions with us. Yep, you can see his overview there again. This is one of my favorite cases to show. When we look at his deeper, closer at his symptoms, you can see, so he had a stroke in the right temporal network and the right parietal. He had a cluster stroke that impacted the left side of his face, his left arm, left hand, and numbness in his left thumb. So you can see his thumb numbness improved 50%. His fine motor coordination in his left hand improved 50%. Spasticity, 60%. Poor word finding, 86%. Poor sustained attention, 88%. Huge gains. More impressively was his sustained attention response task. This test is an objective test that's measuring performance. How fast is the brain moving? How consistent is it? How do you do well with attention and impulse control? His accuracy index is below average. His performance index is on the low end of average. But more importantly, if you look, he's got outlier responses there. He made 17 errors. So what's an outlier response? An outlier response is when you do push the button when you're supposed to, but you're so slow in your reaction time to it that it's considered an error. So if we look, that was what we did before his treatment began. After 20 sessions of neurofeedback training, also important because I don't think I mentioned, he was using his left hand to take this test. We wanted to challenge specifically the improvement in the functioning of his left hand. He has huge gains in his accuracy index here and clinically significant gains in his performance index. But beautifully, he has 2 errors and outline responses. And this is just after 20 hours of treatment. When you combine this objective measurement alongside of his symptom improvement, that's beautiful. I mean, again, this meant he could go back to work. This meant he could return to hockey practice and hockey games with his kids. And, all this stuff translates to I get back to my life in meaningful ways. I think this is our last one. This is a female age 7 who has autism spectrum disorder. She did 20 sessions with us. You can see her overview again slopes down beautifully. When we look at her symptoms a little bit closer, her emotional reactivity improved 60%. Her self-injury improved 88%. Difficulty falling asleep, 70%. And at the bottom, again, we didn't highlight it, but I'm going to point it out, is panic attacks. She had an 80% improvement in panic attacks. This is just one round, 20 sessions. This is beautiful. This is not our most impressive ASD case, but it is the one. She's not in treatment anymore, and I didn't want to include cases that are still in treatment. And she did amazing. Okay, frequently asked questions. I'm so sorry. I will try and get through these very quickly. How many sessions do I need? I think you just saw, right? Like it depends on the complexity of the presentation and the individual, what they're coming in with. Everybody starts with 20 sessions. Most people notice improvement in 6 to 10 sessions, but the industry standard across every type of neurofeedback, except for lens, is that you start with 20. Can I do neurofeedback while on medication or in therapy? Yes. We see people, it enhances the effects of both. A lot of times people say their medications work better. And a lot of times with sleep disorders in specific and anxiety disorders, people are able to reduce dosage and remove benzodiazepines and sleep medications, specific, like anywhere from Ambien, and even when they're using atypical antipsychotics for sleep. And therapy, I'm going to quickly tell you about a gentleman who came to see me because this is so mind-blowing for me. This gentleman came in with severe substance use. He came in with complex PTSD, severe anxiety, and ADHD. He dissociated a lot. He was plagued by alexithymia, which is an inability really to verbally articulate how you're feeling. And so therapy was really painful. He did a combination of EMDR and neurofeedback. And when I was first putting his protocol together, I said, well, we're going to do EMDR first. I was going to increase cortisol levels. And sometimes those are stressful treatments. And then we'll calm him down with neurofeedback in the end. So one day he comes in and he sits down in the chair and he smiles at me and just starts talking. And he's verbally articulating himself. And I'm a little bit embarrassed to say that my first reaction was to start doing an MSE. So I started doing a mental status exam. I wasn't sure if he had relapsed. I wasn't sure what was happening, but this was not a typical presentation for this person in therapy. And he kept going. We went through the whole EMDR session. He didn't dissociate once. His window of tolerance was wider. He didn't get stuck in cognitive looping. He made so much progress in one session, like way more than we had in any other EMDR session. And we had tears. It was, I mean, good tears, not bad tears. It was beautiful. And at the end, he's this huge smile on his face. He's like, "Okay, Jen, well, I'll see you next week." I'm like, "Okay, have a good neurofeedback session." And he looked at me, he's like, "Oh no, I had a scheduling conflict this afternoon. So I actually did neurofeedback right before I came in for therapy today." And when he left, it was like a light bulb moment. I was like, of course, when you help support the nervous system, therapy is going to go so much better for you. So yeah, sorry, that was a long-winded answer, but it's beautifully assistive for therapy. How do we measure progress? The sustained attention response task, we call it a quick test. We use those. It's an objective measurement. The quantitative EEG, an objective measurement. It's not required, but there are some times where I will do it. Screenings, self-reports, our clinical observation, collateral information from family members. And I think that's it. This is my favorite quote from Oliver Sacks, who's a famous neuroscientist. With neurology, if you go far enough with it and you keep going, you end up getting weird. I've been weird since I was a child. My mother will fully attest to that. But, and if you go a little bit further, you end up in the spirit. And that's certainly been my experience as well. So I just want to share that with you at the end. If any of you are still here and you have questions, I'm happy to answer them. Anybody have any questions? No questions. Okay. All right. Well, thank you for coming, you guys. Oops. That was very informative. Thanks, Megan. Yeah. Thank you for coming. I know time and money are the biggest commodities, and I appreciate you spending your time with me today and your curiosity with neurofeedback. Thank you so much. Have a beautiful day, everyone. Bye-bye.